I think it's a wonderful thing to be able to have so many unanswered questions. That tells you the importance and the opportunities that this field brings. Well, we're delighted to have another wonderful group of panelists who will lead us through our third session. It's entitled Our Aging Society: Influences, Interventions, and Impacts. This third session will be moderated by Dr. Jack Rowe, the Julius Richmond Professor of Health Policy and Aging at the Columbia University Mailman School of Public Health. As we have done in previous sessions, Dr. Rowe, the moderator, will introduce the panelists and then will share his unique perspectives on aging society in his introductory remarks. Panel members will provide a macro view of aging, including a discussion of demographics, system requirements to promote healthy aging, and most importantly, aging and health disparities. Dr. Rowe, please proceed.
Thank you very much, and our thanks to the program committee for including us, and especially for including a societal perspective on aging in this broad set of discussions. I'm joined by Ron Lee, who's a professor of demography and economics at Berkeley, Pat Grady, who is the director of the National Institute of Nursing Research at NIH, James Jackson, who's the Katz Distinguished Professor at the University of Michigan, where he's based at the Institute for Social Research, and Elisa Eppel, who is a professor in the Department of Psychiatry at UCSF. I'll begin with some general remarks, and then we'll work our way around the stage here. We just finished a discussion about plasticity at the central nervous system level with aging, and now we're going to have a discussion about plasticity at the societal level with aging. And as we begin these discussions, particularly with policymakers, we find that there are often a set of myths that we have to get off the table before we have a chance at making some progress. So let me just touch on a couple of those quickly. The first myth was taken care of by Laura Carstensen in her excellent remarks earlier today, and that has to do with this view that the aging problem is a transient. You know, it's about the baby boom. It's like going through our society like a swallowed mouse through a snake. And, you know, once it gets through, we'll be back to where we were, and we'll be okay. And it really, as Laura pointed out, is more about increases in life expectancy in general and decreases in total fertility rate, which is causing the aging of our society, although it is being accelerated, certainly, by the baby boom as it passes through. The second very prominent myth is that we need to get old workers out of the workforce in order to make room for new workers. And 20 years ago, economics textbooks called this the lump of labor hypothesis. Now they call it the lump of labor fallacy. And I think that there's general agreement among economists that, in fact, strong economies increase old age and youthful employment, and vice versa, but there is not this reciprocity between opportunities in the labor force for the elderly and for younger adults. The third and final myth is that intergenerational political warfare is inevitable. And many books have been written about this. The young against the old, the middle-aged against the old. It's a very appealing notion on the surface, intellectually. It's just the problem is there's no evidence for it. And survey after survey shows that middle-aged people support Social Security as much as older people. In fact, in some surveys, they support it more strongly than older people. Why would that be? Well, you know, first of all, they realize that Social Security is an economic benefit for middle-aged people. and that without it, they would be paying for the rent and the food and everything else for their older parents. And secondly, they've been paying into it for quite a while. They're future beneficiaries, and they don't think now's the time to get rid of it. So there's really not a lot of evidence of a lack of social cohesion between generations in the United States, nor is there in Europe. That could change with demographic shifts. So the question for me is not, do middle-aged people support older people in the United States now? It's in 30 years, are middle-aged Hispanics going to support older whites? Because there are going to be some differences in the populations, and we'll see. Now, as we move ahead here, there are about 3 principles to keep in mind. The first is that the core institutions of our society, work, retirement, education, urban design and transport, healthcare, the ones we have were not designed to support a population with the age distribution that we're going to have. It's that simple. So if our society is going to function effectively, we need to re-engineer those core institutions. The second is that the focus Thank you very much. Somehow I have a sense I did something wrong, but I'm not sure what I was. But the focus of future policies, and this has been touched on in the previous conversation, but I just want to emphasize it quickly, has to be on the entire society, not just on the elderly. And it has to be a life course perspective. Back to Laura's last couple slides about how we have education and work and then leisure, kind of a role for older people. And we really, really need to re-engineer that life course. And we need to be aware of the special vulnerabilities and the concept of cumulative disadvantage over time that we see throughout the life course. It's not just about the elderly. I'd like to just make a couple comments about what an older society, an aging society, which is one that has more people over 65 than under 15, is our general definition. The general characteristics we look for are productivity. Are people engaged, either in work for hire or in volunteerism? Is it cohesive? Is there a lack of intergenerational conflict? And is it equitable? And these are some of the issues that we're going to talk about. So lastly, what would failure look like? If we do not adapt, what's our society going to look like? Well, first of all, we may not be able to produce the goods and services that are going to be required by a rapidly growing elderly population. Secondly, we'll probably have wider gaps in education and wellness between the haves and the have-nots, and that could, in fact, decrease cohesion. Thirdly, I think, and this has been touched on also by my colleague Linda Fried, who I have the pleasure of working with at the Columbia Aging Center, we will have neglected the opportunity to benefit from the wisdom, from the knowledge, from the experience of a very large, mostly healthy, older population. And that is, I believe, a very, very risky strategy. So with those ideas in mind, let's start, Ron, with you and some comments with respect to demography and economics. In addition to being a professor of both, Ron co-chaired both of the recent National Academy studies on the macroeconomic effects of an aging society. So maybe we'll hear some about that as well. Ron?
Thanks, Jack.